Okay, so before we talk about the issue of physician-assisted suicide, I think we have to say a little bit about medical ethics in general. Um, the values of medical ethics are going to be very important when we talk about the arguments for and against physician-assisted suicide, and they play a big role in the sort of debates leading up to the debate about physician-assisted suicide that Eris and the philosophers who wrote the Philosopher's Brief talk about. So this lecture, I just want to take, kind of quick detour through the basics of medical ethics. Then we'll turn back to physician-assisted suicide and see how it applies to that issue. All right. So there are two fundamental values in medical ethics. And you might see people list some other things. They might add to this list if you're depending on what book you're looking at. But these two things come up in any sort of consideration of medical ethics. And they are patient autonomy and so-called beneficence or well-being. I don't really like the term beneficence. Whoever says that in normal conversation, it's a term just designed to make you go running for the dictionary, right? It pops up a little bit in these debates, so I will use it. I don't like it, but it's common jargon. Patient well-being is a more ordinary, I think, better term, so I'll use that a lot too. What do each of these terms mean? Patient autonomy means that competent patients should be allowed to make their own decisions about medical care. The patient needs to have a choice in his or her medical care, and her ability to make choices needs to be respected. Medical professionals should respect patient choice. They should make sure patients are well enough informed to make a choice, and they shouldn't try to push their own judgments or their own choices on to patients. Beneficence or patient well-being means that medical professionals should only do things that they judge to be a benefit to their patient or likely to benefit their patient. They should not do procedures or give treatments that don't offer their patient a benefit, and they certainly shouldn't do anything that they judge will harm the patient or is more likely to harm than to help. Now, to apply this, you got to balance the size of the harm, the size of the good it might do. These things get complicated, but the basic idea here is anything you do should be justified in terms of a possible benefit to the patient, and you certainly shouldn't do any harm. Now, if you think about these two values, autonomy, respect for choice on the one hand, well-being on the other, they map onto Kantianism and utilitarianism pretty well. Autonomy, very much a Kantian concern, well-being, more of a utilitarian concern, although both of these will register for both theories. There are good utilitarian reasons to respect autonomy, and there are good Kantian reasons to think about patients' well-being. Now, there's an interesting history here. For many years, medical professionals, which for many years meant doctors, there was this societal thought that, doctors are really the only professionals. That's changed, but, if you were talking about medical professionals 100 years ago, you meant doctors, right? And doctors 100 years ago were not really concerned with patient autonomy. In fact, if you read stuff from doctors from 100 years ago or further back, they are incredibly dismissive of patient autonomy. Patients don't know what's good for them, they'll say. You don't need to explain to patients because patients won't make good choices. You know what's better for them than they do. Doctors will even, in some cases, justify flat out lying to patients. Now, that has changed in the last century, especially the last 50 years or so. You know, we now admit a lot more people are medical professionals than doctors. The term medical professional is much wider, and doctors and other medical professionals have become much more respectful of autonomy. In case there are cases where they're not, but as a professional value that they at least explicitly subscribe to, doctors, nurses, other medical professionals will say that they value autonomy. It is a value in the profession. We'll talk about some of the cases that actually led to this change. So-called right to die cases were actually pretty important in establishing the value of patient autonomy. Before we do that, though, I think it's worth saying a little bit more about these two values. Now, in some cases, these values will conflict. What the patient wants or doesn't want, the doctor, the nurse, whoever might judge is not in their best interest. There are conflicts. But truth be told, I think more often than not, concern for autonomy and concern for patient well-being line up. It is going to get in the way of good medical care. Patients are not going to have as good of outcomes as they otherwise would if they don't trust their doctors and nurses. And if doctors, nurses, other medical professionals don't respect patients' autonomy, if they don't tell them stuff, if they, flat out lie to them, then patients will not trust medical professionals, right? And, of course, most of us will make choices that we think are in our own best interest. It is a rare person who deliberately does something that she thinks is bad for her, right? Moreover, we are, in a lot of cases, the best judges for what is good for us and what's not, right? The doctor might think, if we have these different outcomes, this one is the best for the patient. Let's say we can perform a not risky surgery and, you can walk with difficulty. That's the best because they'll, less chance of death, right? But if you are a patient who really values, say, athletic activity, it might be in your best interest to have the slightly more risky one for a greater chance of full recovery, right? The doctor is not you. The nurses are not you. You have a very good claim to knowing what is in your best interest better than they do. And when you get into complicated medical decisions, that's especially true. So usually these two line up, but there are cases where they conflict. And in a lot of the issues around the right to die, which these cases led into the debate about physician-assisted suicide, there is a perceived conflict between respecting patients' autonomy and concern for patients' well-being. And when these two conflict, it's often a delicate balance and a hard thing to figure out how we should balance the two. We can't just ignore one or the other. We have to take both into account, or medical professionals do. So one set of cases where these are thought to conflict, or at least many medical professionals thought they conflicted, was in cases where patients wanted to refuse life-saving treatment or life-extending treatment. In the Philosopher's Brief, you'll hear about the Cruzan case. There are a couple other that are really important here. The Bouvier case and the Cowart case. Cruzan case, it was the family wanted to make a decision to allow the person to die. In both the Bouvier and the Cowart cases, the person involved wanted to refuse medical care that in Bouvier's case would greatly extend her life and in Cowart's case would save it. They didn't want the treatment. The doctors in both cases wanted to force treatment on them. Bouvier actually went into the courts. Cowart didn't. You can find a lot more information about both of these cases. Keep in mind, when we're talking about dying, these are going to be pretty extreme cases, so they're not fun things to hear or think about. But you can find more information on both if you want. But anyway, what these cases did and what more reflection did was to establish this norm that legally and morally competent patients have an absolute right to refuse treatment. If you are a competent patient, even if the doctor or whoever thinks the treatment is very much in your best interest, you have a right to refuse. Even if it would save your life and you will die without it, if you are informed of that and you are mentally competent, you say, no, I don't want this, whether it's amputating a leg or maybe you have a religious commitment against some kind of treatment and they're giving you that treatment, you have a right to refuse treatment. And that's so even when the medical professionals are certain that refusing the treatment is not in your best interest. You might die horribly and painfully without it, but if you say, no, I don't want it, and you are mentally competent and well-informed, the legal and moral norms are they shouldn't force that treatment onto you. We think in these cases, autonomy, the value of autonomy, trumps beneficence, or what we might call concern for the welfare or well-being of the patient. So patients have a right to die in the sense that they have an absolute right to refuse medical treatment, even when that treatment is in their best interest, even when refusing that treatment will lead to their deaths. Now, what's really good to emphasize here and be clear on is that, of course, competent patients do not have a right to be given whatever treatment they want. They can refuse any treatment. They can't ask for any treatment that they judge is in their best interest. If a medical professional judges that a treatment that a patient wants is completely useless, let's say, for some reason, you guys have seen these things from the Middle Ages, the patient says, well, yes, I think my humors are out of balance. I think you should bleed me a little bit to rebalance my humors. The doctor does not have to bring in leeches and bleed the patient, right? If he rightly thinks this will do nothing to help the patient and will only harm them, he doesn't have to do it. If for some reason you wanted the doctor to amputate your perfectly healthy left hand, even if they determined that you were 100% sane, they do not have to do that, nor should a good medical professional do it, right? In this case, respect for your autonomy, your ability to make choices, does not outweigh their concern for your well-being, right? Well-being, in cases where you're asking for specific treatment, their judgment of your well-being can trump your choice. You have a right to refuse any treatment. You don't have a right to ask for and be given whatever treatment you want. Medical professionals can and should refuse patient requests that they judge not to be in the patient's best interests. They can't force anything on the patient against the patient's will, but it's not the case that they should just give the patient anything they might want. Okay, so hopefully that's clear. We will talk in a minute how these two values figure in the physician-assisted suicide debate, and especially also how this right to refuse care, this right to die in that sense, looms pretty large.